G'day guys, Tom here again with our next episode of How You Going, sharing stories with Tom. Today's chat, we've got one of the most inspirational minds I feel that I've had the pleasure of meeting and chatting with, and someone who's very much got the same drive and passion as I have and has taken it to the nth degree. And Dr. Kaine, welcome mate, thanks for coming along. And we start every one of these chats by talking about what has changed from what used to be a colloquial meaning question that the diggers used to ask each other into a greeting. So we're bringing it back and actually asking the question, how you going, mate?
Well, first of all, thank you very much for having me on board. I really appreciate you reaching out, and I'm very excited to be a part of it. And at the moment, I'm going pretty busy.
Yeah, pretty busy.
And it's got pros and cons. I'm doing what I love doing, but the world is in a bit of imbalance at the moment. So there's lots of stress around, and I'm a human, so that impacts me. But I've been a bit up and down, to be honest, in the recent weeks and months, like I think a lot of people have.
Definitely, mate. I can definitely hear you with that. I know I've been struggling a fair bit at the start of this week, and having a chat with a couple of people this week, and that really practicing what I've been talking about has been good. So, look, we met each other a couple of years ago, but tell me a little bit more about who Dr. Kaine Grigg is.
Yeah. So by training, I'm a doctor of clinical and forensic psychology. So my interest in that kind of area started off about 10, 11 years ago when I was a youth worker. So I started in a residential detox, helping kids between 12 and 21 coming off all sorts of substances, trying to get them clean so they could get into rehab and then kind of work through all the deeper issues. So through that, saw a lot of people impacted by trauma, a lot of obviously drug use, a lot of involvement in the justice system, a lot of involvement in child protection. And, it just piqued my interest in wanting to help the most vulnerable people that I could in the community. So started my psychology studies and ended up getting my doctorate at Monash University in Melbourne, and worked a lot in kind of forensic areas, so in prisons, in the Children's Court Clinic, in Thomas Emling Hospital, which is essentially the biggest forensic psychiatric institution in the Southern Hemisphere.
Wow.
As well as working in the male prisons over there. I came over to Western Australia about 6 years ago and started work in the maximum security adult male prisons over here. Worked my way up to supervising teams of social workers and psychologists, and then ended up in the community just a little bit more recently. So essentially, for me, I am my work, and all of that has kind of got me to a point of actually a lot of frustration with the big systems. And I've seen how big systems, both Department of Health, Department of Justice, don't always fit for the needs of the people and can often do more harm than good. So out of that stemmed Fremantle Mind and My Local Mind, which are grassroots community wellbeing initiatives that I coordinate, and was part of the founding of that. And essentially they're initiatives that are trying to do mental health a little bit differently. So we provide only evidence-based sessions, but you wouldn't necessarily walk into a clinic and receive them. So we do things like yoga and mindfulness, drum beat, life skills groups, all these kind of things that we should have access to in mainstream. So I live and breathe mental health, I live and breathe psychology, and my passion I wear around with me everywhere.
Mate, it's so great, and that passion aspect is why I'm really excited to come on here and have a chat with you today, because when we first met, I think in Fremantle at Notre Dame University, I was doing a lived experience chat, and you were chatting about all the amazing work that you're doing. And I think afterwards we just stood there and chatted for about 15-20 minutes, not even recognizing the time. And so that passion aspect, definitely looking forward to hearing a bit more about that. But while we're doing these chats is really opening up these conversations and proving that everybody's got a story. Everybody deserves to tell that story, and I know that from a few chats that we've had, like how interesting your story is and what got you to this place where you are now. But you mind sharing a little bit more about that?
Yeah, so I suppose it was really just working in those systems, seeing how the most vulnerable people in our population and the ones who have the most need are being forced by big systems to fit into a box,
Yep.
and they're being provided with services that don't necessarily fit their needs. And I think my main goal in this life is to leave this world a better place than what it was when I first came on. I wouldn't necessarily call myself a troubled teen, but I did get myself into a lot of trouble, and I was probably lucky to walk out of high school with my certificate and get out of my teens without any formal charges on my record. But I think I caused a bit of yeah. So I caused a little bit of trouble in my early teens, and I think as I matured, I really started to understand that I could have been having a really negative impact on some of the people around me, and that really motivated me to take this to the nth degree and really work my hardest to have an impact, a positive impact on the community around me, because there's lots of people out there that do more harm than good, and it's often because they've been hurt themselves. And I think if we can change the way that we view people who engage in negative behaviours, and we can try to understand why they're behaving that way and support them to do better, I think that's a really powerful thing.
By all means, mate, I totally agree with you, and I can adhere to that comment you made about escaping out of, well, not escaping, sorry, but making it through school, luckily with no formal charges on the record anyway. Yeah, by all means. So you know what, like you've gone through that, and then so you're very open in saying that you live and breathe your work, like what's that like though when you go home, like around friends, around family, like how like you're on the cold face of something that's one of the most serious topics in human life today. And so what's it like for you to come home, and whether it's been switching off or finding an outlet or what's it like?
Yeah, it's a bit of a double-edged sword. So I'm lucky enough to be able to leave my work at work, predominantly anyway. So a lot of people, especially when you're working with really traumatized people, people who are suicidal, people who have experienced a lot of abuse, if you take that home, you're not going to last very long in that profession. And it's not necessarily a skill, but it's just something that some people are able to do. And I'm lucky enough to be able to leave that stuff at work. I check out at 4 o'clock and then I'm back at 8 the next morning, and I'm not dreaming about it, I'm not thinking about it, I'm not talking about it to friends and family. I think that's a really healthy way of working in this kind of field. However, one thing that has been negatively impacted, I think, is that because I'm working often with really pointy-end individuals with really seriously traumatic backgrounds, it means that I become a bit emotionally numb, in that if someone's telling me they've been raped or abused or they're suicidal, if I'm acting shocked or distressed by that, then they're going to shut down. So I need to hold a sense of neutrality in those sessions, enable them to feel understood and heard, but without taking it on completely. And I think that's something that over the past 10 years has actually led me to become a little bit less emotional in my home life. I think it's difficult to do something for 40 hours a week or however long and maintain that sense of neutrality and then be that kind of happy-go-lucky, bouncing off the walls teenager that I used to be. And it's actually had I think it's actually had a negative impact on my personal relationships. So part of what I spoke to you about in our emails exchanged earlier was about I'm one of extremes, and I'm trying to find balance between these extremes of having too much fun or extremes of working too hard. And it's difficult to find that balance. And with the creation of Fremantle Mind and My Local Mind, it began taking up 60, 70 hours a week. And my marriage was actually going through some difficult times, and I think partly because I was not as emotionally present as I have been in the past, and part of it because I was simply didn't have enough time to focus as much as I should have on my relationship. That led to the breakdown of my own marriage, and actually it led to the development of depression for me. So as well as being a clinician, I've gone through the experience of being diagnosed with depression and being treated in the community, but thankfully by a great psychologist who was able to help me piece it all together and come through the other side. But I think it was because I kept pushing for too long and too hard, and that contributed to the breakdown of that relationship. And it's another reason why I'm so passionate about what I do, because I've lived it as well.
Well, mate, yeah, well, and thanks for sharing that with me. Like, I know that we did have a few emails back and forth, and I did really take that to excess story, and that it's like a belief, I suppose, because you're so dedicated and you're so into whatever you're doing that you get so far down that one rabbit hole and don't see the other one. Now, but if it's okay with you, I'd like to ask a couple of questions about what you just said about you going through that depression. And
of course,
because for me, like thinking that, so one of my big things when I first realized that I had depression, I was going down that path, was I didn't know where to look, and I didn't know any friends my age or anyone in my age group and my peers or anything that had gone through it. So I was searching for help, and I was searching for examples. Whereas how did you recognize it? Because you would have been around these sort of things all day and these triggers, and you'd see the whole spectrum. What did it look like to you?
So for me, I think it was like an extreme sense of burnout that was impacting my relationship, impacting my capacity to actually engage with my partner, and then the absolute devastating loss of having someone that you've spent 10 years of your life with walking out on you. And because I've been pushing myself so hard, I just didn't have the coping capacity.
Yep.
And I think, often depression or mental illness or mental health difficulties are a normal response to abnormal circumstances.
Yep.
And I think, many people, if they were in that same situation as I was, would have gone through something similar. And it impacted my sleep. I usually sleep like a baby, so that's a big sign for me. If my sleep's out of whack, then there's something going on for me. I am someone who kind of somatizes, so I feel, I don't necessarily get psychologically stressed that I notice, but I wake up and have a sore neck or a sore shoulder or a sore back or things like that. I just didn't have the motivation to be doing things that I otherwise would be doing. I was a bit of a shell for a while, I think. As much as I'm pretty neutral, I'm pretty smiley most of the time, and I always love a joke at work and at home. So that spontaneity and that kind of humour was lost. So for me, my experience of depression was a reaction to the environment, but it was also a loss of a lot of things that I had, rather than kind of additional symptoms, if that makes sense.
Yeah, mate. Yeah, it definitely does. And hearing you talk about those symptoms and those feelings and the losses and like the signs, I think you called it. Like I can definitely, definitely agree with those and understand what you're saying. So thanks very much for sharing that. And so diving into that depression feeling, but like with what people are feeling today, and like the theme that's going through all of these episodes we're talking about is removing that mask and taking off those fake or outer layers or sort of thing. And I know, like when we were talking about it before, like you were coming up with some great examples of the pressure that people are feeling, especially these days, and to be someone that they're not. Do you want to run us through a little bit of that?
Yeah, I think we all want the ideal of being having true confidence and being oneself, and living as you are without fear of repercussion. or of judgment or anything like that. But that's an ideal that we need to work towards, and it takes time to build up that confidence. And I think, especially early on, it's natural for us to be responsive to the people around us, to be responsive to our parents, and try to fit in. And I think more and more things like social media are bombarding us, and advertising, marketing, they're targeted to make us feel and think in certain ways. And especially for the youth of today, when most of what they see on social media isn't necessarily the truth. There's lots of investigations of what people post on social media, and they don't necessarily post their whole life. They post the good things about life.
Definitely.
So there's constant social comparison, and you're only comparing yourself against everyone else's best.
So those rose-colored lenses.
Absolutely. So I think it's kind of natural. We're naturally drawn into trying to portray ourselves as feeling as good as what everyone else around us is portraying. And we get bombarded with these messages about who we need to be, what we need to be doing, what we need to own. And there's really good evidence to suggest that if we live like that, then it's going to lead to unhappiness, because it just leads to wanting to consume more and more. Yep. So I think it's a really difficult thing to get to that place of confidence where you can truly be who you are.
Very well said, mate. That social media and the influences that we have from external sources these days, it's everywhere you look. Like I went for a bushwalk this morning, and even seen billboards and things like that telling us what we should be doing and not doing. And when we're on this journey to being the best, being you, really, whatever form that takes, it's, how do I do that from a place where I don't even know where I want to go? And I know, chatting with a couple of guys, and something that's been really, really vital for me is actually sitting down and working out what your values are, and working out what your goals are, and putting them on paper. And so around that, I know for me, and through my journey, I was always the larrikin, the first to the party, the last to leave, but I was the one that anyone could come to when they needed a shoulder, or they could talk. But the thought of taking that mask off and being vulnerable myself was the scariest thing I've ever done. And being able to look at myself in the mirror and go, you know what, you've got a problem here. You need to do something about it, because I didn't like the person who was looking back at me any more than anybody else like that person as well. So, so with especially, and you mentioned the youth, and I know when I started this whole journey around heading into the light, I wanted to really target the younger male demographic, but it's just exploded into anybody that I can have a chat with now. But what are some tricks, or not even tricks, but like some hints and tips and things like that you can give people around finding a bit of who they are?
Yeah, I think you mentioned a few really important things by actually trying to understand what we want to stand for first, because if we have no direction, we're going to get there fast.
Yep.
And we end up spiraling, or we get dragged down into places that we don't actually want to be and that we don't value. So if we can actually start to identify our values to start with, start to identify some realistic short, medium and long-term goals, and as you said, actually write them down so they're there for us. It makes it much more concrete and real when we actually put pen to paper rather than just having a chat about it. And then working out, all right, if I stand for these things and I want these goals, how do I get there? And breaking it down into small, achievable bits is really important. If we're living outside our values, or not in line with our values, that's a sure path to psychological distress and all the things that come with it, anxiety, depression, and everything else. So I think you've answered your own question there and mentioned the values. That's the most important thing, I think, for people to get to be the person they want to be. They first have to know who they want to be.
Great. Yeah, there you go. You got to know who you want to be. And that perfectly segues into what I was going to talk about. And this is more about you, Kaine, because this is all about the point of this series is to actually talk with people, and we're getting people from all walks of life. We got doctors like yourself. We've had athletes. We've had mates of mine. We've had teachers. All sorts of things. But really the journey that we've all been on is what I want to share as well. And so I know you've talked about the power of travel. You've felt that and discovering your values around that. And so tell us more, what does it mean in 2020 to be Dr. Kaine?
Yeah, so I think you mentioned travel, and one reason why travel is such a big thing for me is my main motto is that you can't teach experience. And I think
I love it.
It's one of the reasons why my first trip overseas by myself was to Brazil, a place that I knew little about. And my biggest trip was 10 months in Africa. And again, places there that no one could really describe to me. And even if they did describe, they couldn't actually communicate the experience I was going to have.
Southern tip of Africa, though, was it?
No. So it was about 26 countries that we went through. So I started in Morocco, worked way down the west coast of Africa, which has in 2008 had very little infrastructure, and then through the Sahara Desert, through the Congo, down into South Africa, and then back up the east coast all the way back to Egypt. So it was an absolutely mind-blowing trip, and something that I'll never forget. And I think the reason why that motto, you can't teach experience, is so important to me is because going through experiences like that help you to understand the experiences of other people. And part of what I do day to day is work with people that have had horrendous experiences that I'm lucky enough to never have been exposed to. And I think the more you can broaden your experiences, the more you can at least come some way to understand what other people are experiencing and who they are and what their troubles are, and therefore how you can help them. So for me, I really strive for experience, whether it be travel, whether it be culinary, going out for food and drinks, although that's a bit hard at the moment. I seem to pick up more and more jobs along the way just because I want to try something new and different, try my skills somewhere else. And I'm yet to find that right balance. But I think it is part of who I am, constantly seeking experience and trying to better myself. And as I said earlier, to try and be the best person that I can be and have the greatest positive impact on the world around us. So I live and breathe my work, but outside of my work, I try to be a good friend to my friends. I try to be a lending ear to them when necessary, and that does require a bit of balance, because I don't want to be my friend's psychologist. But I want to be there for them as a friend, and so I try to be authentic, reliable in my home life as much as I am in my work life. And I think I strive to maintain those ideals as much as possible.
Great stuff. Wow, again, that's something that you and I have got in common, that value and that experience that you do get from traveling. Like, I've been lucky enough to be in, I think it's 46 countries now, and all across the globe, seeing experiences, seeing hardships, but learning what values mean to different people. And my favorite place I've ever been to was Nepal. And when I was there the first time, I walked up when I was just getting a refill of water from a lady, and the grandma of the village came up, and she sat next to me and started rubbing my belly. And I was thinking, nice little fat Buddha belly, but she's rubbing it with a big smile on her face. And then she rubbed her own belly and then had a sad face and rubbed mine again, and I didn't understand why until my guide Ashok said, well, it actually, because you've got a bigger stomach, it means that you can afford to eat, so you must be valuable, and you must be healthy, and you must be living a great life. And here I am, absolutely struggling to get up this hill, and that's all I needed to hear was to see the smile on this little old lady's face. And it was amazing, where we see it as like gluttonous and you're lazy, you're not getting around, you're not doing any exercise. So that perception of different cultures is amazing, what it can teach you.
Absolutely. Context changes everything, doesn't it?
100%. Exactly right. Perception is always reality to the person who's perceiving it, isn't it?
That's it. Another one of my favourite quotes.
Yeah. thought I just made that up then. There you go. That one quote that I loved that you've said to me before, and when I asked that question, who is Kaine and what is Kaine, and the roles of Dr. Kaine, you said, I'm ashamedly who I am. Yeah. Unashamedly who I am. Now, if that doesn't contextualize everything that we're trying to say, from going through problems like everybody else, living life like everybody else, being embarrassed like actual emotion, just like we're all going through, and you're seen as the person. Well, like from the outside, a doctor shouldn't be going through that. People think that you're this rock with no feelings, that no emotions. So saying that you're unashamedly who you are, well, to me it's so powerful. But why is that so powerful for you?
Well, I think it's, as I mentioned before, I think it's one thing that we need to strive for, and just, if we can all be who we are and not fear repercussion or judgment, then you're going to live the best life you can. And, that doesn't mean being an arsehole. That means being, striving for what you want. And for me, there's lots of people who don't get along with me because I can be abrasive or blunt or any of those things. And that's something that you need to be able to manage when you are trying to be who you want to be. And I would never deliberately go out and try and hurt someone or try and annoy someone or anything like that. But along the way, there are people who are going to disagree with my strong opinions, and that's something that they need to live with. And if you don't continue to strive for your goals, regardless of those people who want to put you down or drag you down or change your mind or debate you, then you're just going to float around and end up being steered by everyone else's desires. So it is really tough to be authentic and genuine and tell the truth at all times, because as much as we can be dishonest to others, but we're just being dishonest to ourselves, really.
It is.
I practice what I preach. I practice my mindfulness. I try to eat healthy. I exercise regularly. I go to our yoga classes. And when it got to a point when I felt like I couldn't cope anymore with what I had, I went out and I got my mental health care plan, and I sought support to try and get through that within the system that we have to support people who have mental health difficulties. So I hope that people can see that I do practice what I preach, and I think that's an important thing, because doctors and psychologists should be the ones that go out and get their therapy more often than anyone else, because they know about the systems, they know the signs, they know when they should be reaching out. But unfortunately, most people burn themselves out and never seek help, because it's even more stigma for mental health professionals to be reaching out for support than it is in the general public. That's a real massive thing that needs to change. Yep,
and I could totally agree with you then. And it's like the mechanic never fixing his own car, isn't it?
Yeah, exactly.
Yeah. So for people that are watching here today, and like we've got plenty of takeaways here, but if they are not in a good place, and you mentioned the mental health plan, can you give us a little bit more background for if people want to find out more information about that?
Yeah, sure. So in Australia, we're really lucky with our health system that you can get what's called a mental health care plan from your general practitioner. And not most places, but there are a lot of places around Australia that have GP practices that bulk bill, and that means that you can go and get a mental health care plan that allows you to get 6 sessions from a psychologist that are bulk billed, which means that they are free. There are GPs and psychologists that charge what are called gap fees, so you might have some out-of-pocket expenses, but you can find GPs and psychologists that will just charge you the Medicare rate. And then after 6 sessions with that psychologist, if you still need further intervention, you can go back to your GP and get an extension of another 4 sessions. So you can have up to 10 sessions a year with a psychologist, fully funded by the government. And you can get that for things as broad as anxiety, depression, schizophrenia, eating disorders, any issue that calls for a diagnosis. then you can get those sessions for free. And I think it's a really important thing to do. We don't need to be in a place where we're suicidal, where we can't get out of bed, where the world is falling in around us. We don't need to get to that stage. You do need to meet the criteria for a diagnosis, but you can have a mild mental health condition. So say if your sleep is changing, if your food intake is changing, if your mood's low, if you're starting to have suicidal ideas, if your mental health is impacting your capacity to work or engage socially or in your relationship, then you'll most likely meet criteria for a diagnosis, which can then get you that mental health care plan and get you some psychological intervention for free.
Wow, that's amazing, and thanks for sharing that, because I know it. Even when I was starting to go through my depression and my mental health battle, like I didn't know about those sort of things either. So finding out about them is amazing.
Yeah. On that, before we move on, at the moment there is new items that have been introduced as a part of this COVID pandemic.
Yep.
So if you are feeling isolated, disconnected, or you've been diagnosed with COVID and you need to self-isolate, there are sessions available, 10 sessions a year available for that purpose. So you don't need to have a diagnosis to receive that.
Okay,
you just need to fit in some of those categories. So you can do all of this by telehealth now. So you can call up the GP, that's bulk billed, and then you can call up your psychologist, and that's bulk billed as well for those sessions.
Great stuff. There's something I didn't know about, so thank you very much for sharing that. Well, mate, like we've talked some pretty intense stuff here, and shared a great story. Like the time's flown by. To go back around, like having a chat, not having to feel like you have to hit rock bottom to actually go through it, and that's been a common thread with a few people we've chatted to at the moment. It's like I didn't realize I needed help until I got to rock bottom, and so I remember back to the Fremantle chat the Notre Dame chat, sorry, that we had, and there was the GP and a GP that was there, and he was talking about, can you imagine a not everyday GP talking with a 25-year-old male who went in and asked for a mental wellness check, and he'd tap him on the shoulder and say, "You're doing well, mate." But really pushing, looking after yourself even while you're healthy is that big thing. And you're right, that whether it be your yoga, your meditation, your exercise, and for me, learning those trigger points when I wasn't quite right, and it's not so much a sleeping, but it could be I get a little bit angry, and it's hard enough driving with Perth drivers anyway. But
especially if they're trying to merge.
Exactly what I was going to say. Yeah, there you go. So I really appreciate you sharing those facts. So maybe just to wrap it up, you've mentioned what it means to be yourself, what it means to be proud to be you. What's a tip for people to take away to be proud to be you? Short and sweet and to the point.
Just be yourself. Figure out who you want to be and chase it.
Chase it. I love it. Well, mate, I think we might wrap it up there, because we've got some absolute gold. So thank you very much for coming on and having a chat. Remind everybody that, that we are going through some troubling times now, but there is help out there, and you don't need to get to rock bottom. And you know what? We've all got that story, and it's okay not to be okay sometimes, and actually do something about it. So
absolutely.
Thanks very much again, mate. Any wise words to finish off on?
No, I just want to say thank you again for inviting me along, and congratulations on doing the great work you're doing. It's really, really important that we keep talking about this stuff. Yep. The more that we talk about it, the more that people are going to feel comfortable in reaching out before they do hit rock bottom. So there's a huge number of supports available to us. You've got the mental health care plans, you've got services like Lifeline and Beyond Blue, you've got community grassroots services like Fremantle Mind. There are people out there who want to help you, and I'm one of the helpers. I don't do it just for a paycheck. Like, I need to get paid so I can pay my bills, but I do this because I'm passionate about it. And most of the people who are out there trying to help people are doing it because they're passionate about it. So reach out. There is help out there.
Love it, mate. Love it. And for people that want to know a little bit more about Fremantle Minds, how do they find out about that?
Yeah, so they can go to our website, www.fremantlemindorg.au, and they can find out all about the free services that we offer to the community, including all of our services currently online at the moment.
Great stuff, and I'll share that out as well. So we'll wrap it up there, Kaine. Thanks very much again, mate, and yeah, we'll catch up soon.
All right, thank you.
Cool. How was that?